medical transitioning kasi hindi siya masyadong napag-usapan and maybe people are scared to talk about such a, diba? It's a heavy topic, it's very technical, it's very, ang dami mga complicated aspects of it. You've gone through this and I wanted to get your tips, your advice, like what was your journey like and what did you learn from it and what can you take from it that could help others going through the same thing?
Okay, I can start first. I started mine in college. Kasi my undergrad before was biology and then I shifted to a different one, social science one. And then, syempre parang biology, medyo maiintindihan ko kung how meds or medicines work. And so, I got information online lang how to self-medicate and I realized that I was, what is it called? Overdosing myself. There you go. I was overdosing myself. I was using the contraceptive pills, and you're not supposed to use them. But I was overdosing them. So you're supposed to, if one harm reduction practice is you just take one a day. But what I was doing, so I was taking three, and then a day, and then I was overdosing myself with hormone blockers. So talagang I think after 3 years, talagang lupay-pay yung katawan. You're always pale, hypotensive ako, and all that. I need to stop. I need to recuperate. And then when I learned, I was working in the HIV sector where we're doing a lot of transgender health work. And then I realized, okay, now I can get back, and then I have these more ways of doing medical transition in a safely manner. So I think that was really, really helpful. So I would recommend that. So we have this Philippine Professional Association on Transgender Health, or PPATH. So please look them up online, or Transgender Health Philippines, or Trans Health Philippines, where they provide information on safe transitioning, medical transitioning. Because I understand that some of these medications that a lot of trans girls use are not really recommended, but because they're cheap, they're the ones accessible and available, yun naman ang kukunin nila. So at least you know how to, what are your harm reduction practices to ensure na when you engage to this stuff, you are well informed and you know how to mitigate any issues that you might think. Kasi mahal talaga siya. You need to have, at least for us, 1,500 to 2,000 a month, and then you need to get your labs pa, and then your checkups pa. So it's really expensive for someone who don't have that capacity.
Yeah.
That's why I think one of the calls is to include that in our insurance system, because
Bigat nun, eh?
And this is I think when we talk about universal healthcare, we have to talk about everyone accessing healthcare. I mean, we're paying PhilHealth, we're paying so much for this, right? And everyone should benefit from it. Hindi lang some people or cis people, right? And marginalize other people. So I think our health system should be responsive to the healthcare needs of everyone.
For sure. For me, my journey started in 2021. So I've been out as transgender since 2016, but I only started medically transitioning in 2021 because I wanted to do top surgery first. Because of my family's medical history, I was a bit apprehensive about hormones because we have a history of hypertension, diabetes, and I was worried that if I did my hormones first, that it would, affect my viability for top surgery.
What's top surgery? Can you share?
So top surgery is the surgical procedure wherein transmasculine people have their breasts removed, and then they undergo a masculinization of the chest. So I underwent that in 2021. I paid for everything out of pocket because I did not have any kind of healthcare that would cover it. So I saved up for it for a year before I underwent the procedure. And it was, it was difficult because it was such an expensive procedure. I spent a total of around 170 to 175,000 pesos on top surgery. And that was even considered like that's even considered like a cheaper end. There are some surgeries that cost up to 250,000 pesos, and I was lucky because my surgeon during that time was offering like a promo, so he was offering discounts for top surgery because he's been doing top surgery in the Philippines for a long time, and I was able to do it because my partner supported me, my friends supported me, my family supported me. And after I recovered from top surgery is when I started doing hormone therapy. Gender affirming hormone therapy, I started 2022, just a few months after top surgery. And I went through, I think, what most trans people are doing now, which is they go through the medical sector where it's like Love Yourself and Trans Health who offer free consultation on gender affirming hormone therapy for trans people. So that's how I started because I did not have the budget to see a private doctor.
It's very expensive.
And so it's very helpful to have those organizations also. And compared to Vashti, I think our hormone therapy is considerably cheaper. Our hormones only cost about 150 to 300 pesos a month, but our lab tests are also expensive.
Yeah.
We have to do our lab tests every quarter, so every 3 months, to make sure that we're healthy because testosterone can have quite a lot of side effects if you don't dose yourself properly. And so I see my endocrinologist every 3 months, and I spend about 3,000 pesos every 3 months on the lab tests and the appointment. And I've been on testosterone for 2 years, and it's been great.
Can I also add? Yes, I think there's a very important point that we need to mention that when we talk about medical transition, there are different types, and it depends on what you want, like what are your needs. So, for example, we have gender affirming hormone therapy. Then we have top surgery. So for trans women, it's putting if you don't have enough breast tissues, you can put up more.
Breast augmentation.
Breast augmentation, and then bottom surgery. So for trans women or trans feminine people, it can be vaginoplasty, vulvoplasty, so on and so forth. So having, in the past we call it sex reassignment surgery. So for
trans men, we also have bottom surgery, but unfortunately, it's not locally available in the Philippines. The closest country I think that you can go is Thailand to be able to get bottom surgery. But it's also like super expensive. I think a million pesos if you based on the conversion rate to be able to do it.
And then we have facial feminization surgery. So I feel like especially for trans women, trans feminine people, it's very, very expensive because the idea of passing is so like this is a burden to all women, right? We're all supposed to look the same way or look a certain way, look super feminine, and it's so difficult sometimes, especially to those who have characteristics that are considered super masculinizing. So, and thankfully, also just to plug, Strap has our own doctor who helps us, supports us in terms of our medical transitioning. So to those who are listening, maybe you want to join us.
May support, like a medical professional.
She's part of PIPA, si Doc Amy. So she's very, very supportive. She's a doctor. She provides all these. She provides gender-affirming hormones to trans people and non-binary people. So she's very accessible.
That's great.
Yeah. And if you want, you can visit her.
Where is it? Manila though?
Yeah, I think she's based in Taguig. If you want it free, you can join us at Strap. But of course, you need to pay her for her work. You need to consult with her. But rest assured, she's super friendly, trans friendly. Kasi sometimes you also have to choose your doctor, right? Kasi minsan, papasok mo pa lang sa clinic mo, may misgender ka na, tatawagin ka with your legal name, imagine. So, maaning ka. So, parang, why would I... so usually, for example, for me and a lot of the girls, when that happens, we just walk out. So, we've heard a lot who are not able to access healthcare and now nag-deteriorate sila in terms of their health. So, imagine, just because you can't provide gender-affirming healthcare, you exclude people to really getting the healthcare that
you need.
you're supposed to give.
Yeah.
Right? Yeah.